There we are. Hi, everybody. It's Dr. Linda of the Vascular Birthmarks Foundation. I'm looking at it on my phone, so I'm not seeing it yet. Am I?
I can see it.
Oh, you can see it? Yeah, but I need to see the question.
Yeah, I'll just come through in a second. So we want to get started.
Okay, so anyways, welcome to our January 2021. I can't believe it's January 2021. For VBF's Facebook Live with our very own child life specialist, Leslie Graff. Leslie is not just a child life specialist, she is the mother of a boy that has a port wine stain, and she's been in part of our family for, I don't know how long, Leslie, about 15 years?
15 years.
15 years. Okay, yeah, so I'm seeing it now. Hi, Mahala, Lindsay, other people are on now. So say hi to us so we can see it. There we go. Candace is on and Sarah Hill are watching us. So Leslie is a child life specialist. She's comes to all of our conferences. She does group sessions with children, adults, teens living with a birthmark, and she's here today to answer all your questions regarding living with a vascular birthmark anomaly or related syndrome. I see a lot of people are watching. We already have 21 people. No questions yet. I'm not seeing any. I don't know if anybody else is, but we are ready to take your questions. Leslie's waiting, ready and waiting. And while they're ready, Leslie, why don't you tell us a little bit about your experience as a child life specialist?
Sure. So I really love being a child life specialist because our job in a clinical setting is to sort of minimize the negative impacts of hospitalization, stress, illness, grief, loss, all of these sort of factors that come into play. So we sort of want to reduce the developmental disruption for people in terms of the way that a condition or an experience impacts them. We want to minimize that disruption in their life, and with a special focus on the psychological, social, and emotional components of that. So really trying to think, how does this affect their life? How does it change their experience from what a typical experience might be? What are those sort of touch points that may cause additional stresses for, say, a family system or for an individual patient? And then how can we actively, knowing those things, then actively apply coping to make those situations less impactful or less difficult, or so that they have less of a negative impact for people.
Thank you very much. And I'm seeing again, quite a few people are on. We're waiting for you to submit your questions. And one of the things that Leslie and I were discussing before you guys all joined on, hi Corinne, Corinne's on, was that children experience pain differently. So a lot of the parents take their child for a laser treatment without anesthesia. And you were saying there's a couple different methods that you favor for that. If you would like, before some questions come in, maybe you could discuss some of those methods.
Right. I think one of the big things for patients who have a port wine stain, part of their treatment regimen often involves a lot of laser treatments. And depending on the age of the child, depending on the location, and the size or the areas that are affected by the port wine stain kind of helps determine approaches that you might use in terms of treatment, or how to make that treatment less problematic or less difficult for the child. So one of the big factors is often the size, right? How long it will take for a treatment procedure to occur. If it's a larger port wine stain that covers a larger area or certain types of tissue, right, that might be a little more complicated, again, that might change the timeline of treatment. So we want to think about, okay, what's the timing and duration that this child might experience pain? How old are they? What's their, sort of awareness and response to pain? We know that children feel pain. That infants feel pain, right? There used to be beliefs long ago that children didn't, and we know that they do, but we also know that their sort of memory responses or their ability to cope with pain changes and evolves and adapts. And children still encounter other painful things, not just this treatment, but other things, whether it's an immunization, whether it's falling down, whether it's, so we try to also look at the pain of treatment and put it in relation to other pains or difficult experiences children may encounter, just so we can sort of ground kind of how traumatic or how negative that experience might be for them. So some different things that we approach is, one, the decision to treat with anesthesia or to not treat with anesthesia. Again, weighing out the risks and benefits of that. One, the child having no memory or recollection of the treatment, or of the pain of the treatment because they're not awake during that. But then again, balancing out just the side effects of it makes it a much longer, more involved procedure, things like that. So if they are choosing to do it without anesthesia, one of the big things we talk about is the positions of comfort, so the child feels supported by the parent, but that they're still in a position where they are safe and not moving, because again, moving around too much during the treatment can compromise the outcomes of the treatment and make it more difficult and lengthier for the child. So we want to ensure that they feel supported and as safe as possible, but we're also trying to minimize the duration or the sort of separation from parents or the sense of forcible holding, trying to hold a child down and all their limbs and arms and legs does not work very well. And so we've learned that, having them in a close hug by a parent, whether it's laying next to them, whether it's holding them on your lap, forward facing or chest to chest, those things can help for the situation to be much more positive for a child. And then also planning, okay, immediately when treatment finishes, if it's an infant, you might nurse the child when it's, things that help them return to baseline quickly so that they're not kind of in this chaotic, disrupted state for very long, but you can sort of reconnect with them, help them to feel safe and secure, and really mark the end of the treatment experience for them.
That's very comprehensive and very useful information. Thank you. So Jody Lee, Meghana's mom, Jody, she's part of our
Hi,
team.
Jody.
Her question is, she has an issue when people say remove the birthmark, because as you know, the etiology of these are, you can get clearance to a certain level, but quote, are they ever really truly removed? So when somebody says remove the birthmark, it kind of bothers her at a couple different levels, and she was mentioning this to me. So is there like an effective tool for, or maybe verbiage that we could use better? Like I use clearance, but I don't know, what's your thoughts on that?
Certainly. Language is one thing that we're often concerned about because, again, it sort of denotes our biases or our feelings or our relationship to that. And again, remove is a strong word in the sense too that you're very correct that it doesn't work that way, right? It's not just a like pull it off kind of experience, which is kind of what we associate with remove, is like you just peel something off, and we know that's not how it works. So I think I always encourage people to use very specific language. So how we might talk about clearance, how the birthmark appears, right? It may appear lighter after treatment, right? It may be less noticeable after treatment. The area affected may be, so I always try to use language like that, or there's a difference in that area. I know I had a mother I was working with recently, and we talked a lot about language and how, sometimes the language stigmatizes it in a negative way, right? Like sometimes one parent will say, well, I'm glad my child's port wine stain isn't that bad. And I think, but what about the mother who's sitting next to you, whose child is very affected by their port wine stain? Is that child's bad, right? So we want to think about that. So I think when we use clearer language in terms of whether we're talking about the area that's affected, like a larger area is affected, that's descriptive language. Or clearance. The port wine stain has become lighter because of treatment. It's not removal, it's not, and I think those also sometimes create false expectations, as so many patients have experienced through many painful treatments. It's not that simple. And so sometimes I think terms like that are also painful terms because it minimizes the emotional, the physical investment that people have had to go through to achieve the results that they have in terms of lightening or changing the area that's affected. So I think, yes, I think being sensitive of that language and just saying, treatment helps to, and there's lots of reasons why people are choosing treatment, whether it's to prevent thickening, whether it's to, reducing risk of more problematic changes later on, or it's lightening, or, trying to, sort of maintain where something is. So I think, again, yes, being really specific about that language and trying to use the most descriptive language that we have that's honest, right? What is it actually doing? How is it actually interacting? And when we describe that more specifically, it probably honors the patient experience more in that.
Thank you. There was another thing that Jody and I spoke about, and I thought it was excellent for us to discuss today. And it is, for example, for me, because this is my life and it's been my life for going on 27 years, it's hard to believe, but while I do see the birthmark, I actually see the person first. And that's something that, Jody was like, she doesn't see the birthmark, she sees the person. And she wants to be sensitive about that, because is it insulting a person, if you're like not cognizant of their birthmark? Obviously I am, but it's completely clinical. So I'm like, okay, these are the, but I always see the person. I forget they have a birthmark because of all the years of doing this, and I think that is a really good point with the sensitivity of seeing somebody's birthmark, but not seeing the birthmark. Is it positive? Is it negative? Are you insulting them? How do you address that?
I think that's a really good point to make, because I would say it's very true. The same thing, I've worked with this population now for a decade and a half. So I've seen many, many people with different vascular birthmarks. So to me, that's a very normal, typical thing that I see all the time. It occurs with a great frequency in my experience. So to me, seeing someone with a birthmark isn't necessarily different than seeing someone who has different eye spacing or different hair color, or, what I'm saying? There's so many differences in our normal, typical appearance that to me, that's in that spectrum of differences that people have. And I think I noticed the same thing because I do a lot of work with children with cleft lips and cleft palates. And it's so funny because sometimes I'll go out and I'll think, oh, that child must have a cleft palate because I don't see that they have a cleft lip. And I forget that everyone doesn't have a cleft lip or a cleft palate, because it's just so normative to the population that you work with. So I think actually when you get to that point, it's not offensive in the sense that you're saying, I don't see it. You're saying, I see you first. And I see this element of you. And it's probably a really defining difference, because most other people they encounter see that first, right? Because that's not something they're used to seeing. It's not typical in their experience. Their attention is immediately drawn to that. But in some ways, it's a really good thing, because other people in the community often can look at you and look you in the eye and talk to you just like they talk to someone else. They're not averting their eyes because they're afraid they're staring. They're not, their eyes aren't kind of drifting over to keep looking at the birthmark. They're just looking at you as a person. And I think that is one of the great things about being in this community, is as that experience, you know what it feels like to have people look at you or look at your child, and not even always in a conscious way, in a way that's a little bit not the way that we tend to look at other people, whether it's a little bit of staring, whether that's out of curiosity or anything else, there's a little bit of a change. So I think one of the great things within this community is being able to say, I see you as a person, and I appreciate this as part of your story and part of your experience, but you're not an oddity to me. I don't, that's not what defines you in my eyes. This is a part of your story, and I recognize that, but I want you to also feel known and seen as a whole person and not reduced to your birthmark.
And that's kind of like our theme for 2021 is more than a birthmark. You are more than a birthmark. I am more than a birthmark. And we're collecting fun facts and interesting things about our population. And we're rolling this out this year because you can tend to get all caught up in the medical, but you know, some of these people are lawyers, dancers, brothers, sisters, dads, firefighters, military, singers, artists, so many different things. And we're really excited about our More Than campaign. So we have a lot of you guys are on, so go ahead and submit your questions. And I have,
I think that point that you're making is really important, because a lot of times parents say, how do I help my child? You know, they're young now, but how do I help them optimally grow through this experience? And one of those things I always say is give them ways. I think especially as our culture is very, very image focused and sort of hyper, you know, things are photoshopped, things aren't even as they are. You know, there's this unrealistic standard of beauty as it's defined by singular sources, or these different things, and those pressures or the influence of the media that we see constantly all around us that sort of subconsciously conditions us to certain things. And we want to be sure that we're really helping people feel that sense of identity from the things that they have control over, from the things that they do, from the things they can contribute, from the things they create, from the strength they bring to others, you know, from all of those things. I always tell parents, these are the things to look towards, to encourage your children in, to support them in, whether it's, you know, I always love the arts, because the reason you love one song on the radio is because it's different from another song. The reason you go to a museum and you go, this is my favorite painting, is because it's different from all the other paintings. And that's what's beautiful. And that's why you go, is to see all of these different amazing voices. And so the more that the things that we encourage each other in our community, our children, in these areas that are inherently supportive of differences versus things that have a singular point of this is good or this is success. But when we have these things that are very divergent, that show the benefit and value of so many different things, I think that makes it easier to accept visible differences.
it's excellent. So we have a number, and I know, you know, quite a few of the people that are on, I know most of them. And we have like a grandfather on, and he has twin little girls that are about 2 or 3 now, a dad who has like a 3 or 4-year-old and a new baby, and they both have port wine stain. What's a good way for a parent? I mean, we talk about the child next, but what's a good way for the adult with the birthmark to explain to his children or his grandchildren, the little kids, about what is this thing on grandpa or dad?
Right. So oftentimes the way that we explain them is sort of developmentally tracked, right? What we're going to say to a 2-year-old is going to be different than what we're going to say to a 6-year-old, and it's going to be different to a 12-year-old, right? Or, you know, so it can go from just, it's a birthmark. Like some people have birthmarks that are brown, some people have birthmarks that are red or pink, you know, different people have birthmarks in different places. This is my birthmark. So something like that can be very simple, you know. And then sort of moving up the line, sometimes people might say, well, why is it that color? Why are some this way and why are some this way? And explaining it, even, for example, you know, when you exercise and your cheeks are pink because there's a lot of blood flow in that area. But, you know, explaining that sometimes the vessels, the structure of the vessels in that area is different. And so it stays pink all the time. And sometimes just those simple explanations can help people to understand something like, oh, that totally makes sense. And they can understand that it's limited, or just a little more of the etiology of the stain and how it functions. But I think just sort of building on that developmentally as people have questions, but it becomes much more normative when they can connect it to something else that they experience in their physiology that helps them, you know, like if you're running around and then your face is red, and you can see how when you have that vasodilation and all of that, right? And then it goes back to normal, and just understanding that in those areas, it doesn't have the same structure or control to sort of close off and, you know, go back to the same, to change colors the way that the rest of ours do. But I think those are kind of the simple explanations, kind of moving to more complex.
Awesome. couple more questions. So one of them that's my favorite to always discuss with you, because it is a pet peeve of mine, is saying to your child, this is your birthmark is a gift from God. Angel kissed you, and then they're dragging them by the heels to get it removed.
Exactly. And I always, I warn people about the specialness, right? Like we want to connect the specialness with who they are as an individual, and we don't want to put too much on the birthmark, because it's just like, it's a part of who they are. But if that becomes a thing that's special, it also creates an interesting conflict. So if the person chooses to work on treatment, right, or wants to minimize the appearance of it, it's sort of like, well, I guess I'm not okay with myself as I am if I choose to pursue treatment, but I should be okay with myself because everyone says, you should be fine with who you are, just the way you are. And so there becomes this conflict, or kids feel afraid to talk to their parents sometimes about treatment because it's always been what makes them special. Well, what if they don't want to keep, what if they don't want that to be a prominent part of their story or their appearance? Then they may choose to pursue treatment in terms of that. And so I think that is always a sort of a balance to, it's something that's unique about you, but again, making it feel like they should. And it also sort of assumes they should love it, they should want it. And I think anytime we have an experience that's not typical of what other people experience, but it's not something someone chooses, that's a difficult emotional place to be in, right? To be like, you should be happy about this, when the child's thinking, why am I happy about this? Everyone stares at me. People make comments to me like, how is this special? This is not the kind of special I want. Or, yeah, why would God do that? Like it can be very disruptive to that sense of security or identity. So I think finding that balance between it's something that's unique about you, and we make choices at different points. And if you would like to pursue treatment, if we want to look at ways to minimize its appearance, or that might also involve makeup decisions for some people or things like that, but ensuring that there's not too much of that specialness that makes them almost feel trapped in that experience.
Excellent. We have a real, like I've seen this for 27 years, and you've probably seen it a lot too. There's a real camp of division, and one camp is people who really don't like their birthmark. Some of them absolutely hate it. It causes depression. Some of them have told me they've had suicide ideations over it. Some of them don't want treatment because it was painful in the past. And then I encourage them to get a test spot now, because we've got dynamic cooling and things have improved so much over the years. And then there's the people that just love their birthmark and they don't want to remove it, but I feel obligated to tell them that it can thicken and cobble and bleed. And down the road, you can develop glaucoma. Just because you have a clear checkup at age 1 doesn't mean you can't have this issue or that issue when it's in that area. So we are, obviously, our mission statement is not just networking people into treatment, but it's acceptance for people who choose to live with their birthmark without treatment. And we feel that's very important. But how do you find the balance with, this is a medical condition, these are your options. We're not saying you can't love it, but you should get the correct information. And then those who hate it, they really don't like it, and they've actually written to me and said, why are you promoting this? I love my port wine stain group or something like that. And I'm like, because everybody has a different perspective on it. We want to respect everybody's perspective.
Right. I think that's really important because people do come from very different experiences. For some people, their negative associations may come from things their parents said about it, or being bullied as a child, or, there are a lot of reasons why people may have some negative associations around that. Or like you said, older treatment protocols that were painful and less effective. and they're, they sort of think, yeah, that's not what I want. And for other people, they really feel its impact or its limitation in their lives. And other people say, I haven't, I've gone on, I've done, what I want to do. It doesn't define me. So I think one of the important things is that there isn't judgment on treatment, and that we do provide accurate, up-to-date information on the implications of treating or not treating, right? Like, as we've talked about, that choosing not to treat may not have immediate consequences, but could potentially have consequences down the line. So understanding those trade-offs, because I know sometimes parents say, well, it's just cosmetic, I don't want them to go through the discomfort, I am worried about that for them now, but I want to be sure that they understand that their options or their clearance may be affected by that decision if they choose to wait decades to pursue treatment or things like that. So I think helping people to really understand, this is what might happen should you choose not to treat. These are potentials. If you choose to treat, this is, and also I think you made a really important point of knowing where the technology is today, and that where we are, what potentially can receive some clearance that maybe wasn't possible in the past. Because a lot of times people, especially older people with port wine stains, may have lived with it for a long time because there really wasn't effective treatment options available for achieving clearance. And so now there are, but they may not be aware of that because they're not necessarily in the community. So I think it's important to be a resource to help people access that information, because who would share that information with you, right? Like, most people on the street aren't going to know that. So it's important that VBF plays that role too, to be sort of a clearinghouse of information for people in all these different areas to know what's available, what are the potential implications, and what are those costs to weigh out, because it is a very personal decision in terms of the emotional commitment, the physical experience, the social impacts, all of those different things.
Thank you. Yeah, and I'm not seeing any of the questions, but I see that you're all watching. So hopefully I'm covering the question. Oh, I got one from Nicole Miles. Hello, Nicole. So the importance is not to make it so big. Sincerity is, from my experience, the most important thing to explain exactly with the real simple words. My son, 9 years old, really gives answers so simple. It's my birthmark. This is how I was born. He really doesn't care about, the rest. And then it says, thank you for your great effort and support. I think that's brilliant.
Yeah.
Just stick to the facts about what it is,
And people don't, they kind of accept it as just part of you, right? We all have those unique differences and things about us or about our appearance, and that's just one of them.
And so then Elizabeth, and again, we're trying to cover all aspects. Elizabeth, sure. She's like, this is great. I would love to see a follow-up one on the psychological impact on the parents of babies born with hemangioma as well. And I was one of those parents. So I can actually tell you that I experienced PTSD from it. I was wandering from doctor to doctor. There was no website, no foundation, nothing out there at the time, which is why I started VBF. But I do know what it's like, and that's what my dissertation was on for my doctoral degree, which was assessing PTSD and acute stress in parents of children with facial birthmarks. So, I mean, if you would like to just
speak to that.
The acknowledgement of that.
Yeah, I think that's very important. And whether it's a hemangioma, a port wine stain, some of the other syndromes that we have, all of those parents can go through sort of a trauma experience. I mean, the hemangiomas, I think, can be especially prone to that because of the rapid change, the dramatic experience of that. But as I said to other people, most of us don't, go into the hospital to deliver a baby and think, oh, I bet my child's going to have a vascular birthmark, right? It's not even on our radar. And then you have a child who has a vascular birthmark, and you're suddenly, it sort of disrupts this whole experience. What do I need to be thinking about? What do I need to be worrying about? How is this going to affect my child? You know, for some parents, it's like, is my child going to go blind? Is my child going to be able to breathe? Is my child, you know, depending on the area that's affected, or, you know, for parents who have a child with a port wine stain, is my child going to have Sturge-Weber? Is my child going to have seizures? You know, your mind is jumping decades ahead, wondering how this is going to impact your child, not knowing where it's going to stop. I think hemangiomas are especially very terrifying for parents, right? You don't know how much, how fast, how long, right? They sort of, we know they have certain tendencies and cycles, but as it's immediately happening, you kind of don't know what's going to happen next week or next, you know, it can change so rapidly that is, you know, there's just no sense of security, and it's very isolating. It's difficult to, even as a parent, I think, to accept that altered appearance of your child, because again, it kind of wasn't what you're expecting, and you're not quite sure how to integrate that into your child's identity and personality. You know, so many parents will say, well, the hemangioma was on this side of their face, so I would prop them this way when I would take pictures to show family or friends, because I wasn't even to the point of really being my head wrapped around it yet. And I wasn't ready to share that with other people, or to have to get into those conversations and spaces, because I was dealing with this incredible stress and grief. And I think a lot of times too, parents talk about the challenge that is for them. And I try to explain that it's because for many parents too, they're grieving the loss of a typical experience for their child, right? One that's just blissful, without complication, without a million doctor's appointments, without medication, without treatments, without, right? We're grieving that sort of experience for our child, which is just lovely and peaceful and gentle. And instead they're thrust into this world of, you know, dragging them to appointments and trying to figure out what's going on, and just the parental stress, because all of us want to do everything we can for our children. We love them desperately. And so just this emotion that is tied into, you know, that bond of survival for our children, and doing what we can to help them and support them and protect them. It's so many different emotions that you're going through in this still early attachment bonding phase, when, you know, you're supposed to be just able to focus on your baby, but instead you're having to think about all of these other complicated factors. And so it is a lot for parents to process. And I always encourage people to reach out to get counseling support from mental health professionals, because sometimes you just need a safe space where you can talk honestly and openly about some of those emotions you feel. Sometimes you don't feel like you can do that with a spouse or with other family members, because they just don't quite get it. But you need a sort of neutral space where nobody's going to judge you for saying, this was hard, or this was difficult, or, you know, I didn't even know how to handle it, or I was struggling, or I felt jealous when other parents, you know, have a new baby and their life doesn't involve any of these things that my life now involves. Or, you know, there's so many different emotions and experiences that can be tied up in that. Or just knowing, how many doctor's appointments do I go to? Who do I trust? Who do I listen to? There's just disruption on so many levels that it really is a difficult experience for many, many parents. And it's not, it stretches out over time. You know, it's not just a week or 2 weeks, it's an ongoing, continuous experience of more appointments, how's treatment going, you know. And so that whole kind of early infancy period can be a little bit disrupted by this sort of transition and condition.
Excellent. I love this comment from Jennifer Van Rooy, or Roy. Excellent. I can totally relate with her, even though for me it was 20 some years ago. She said when she's out in public, she often explains to new people in a nonchalant way that her son had laser treatment. These are the spots from the laser. But what she's saying is, should she wait for them to ask or do it? Because that's what I like. I would read people's faces and see that, like, a gasp on their face, because remember, as my daughter it was her whole lip and it was swollen with the hemangioma, and people actually accused me of child abuse. and I had to explain it was a hemangioma. So when I would see people looking shifty at me, like almost wanting to like call me out, I would say, it's a hemangioma, it's a benign vascular tumor. And I guess I was protecting myself and her doing that way. So do you have an opinion on whether you should be proactive or wait for them to speak to you?
You know, I think the proactive approach is actually great because a lot of times, if you don't say something, like once you put that information out there, then that person sort of has an interesting frame of reference, right? When they see, if they see someone else, they may go, I bet that person had laser treatment. Because I remember someone telling me, I remember someone else who had spots like that, and they said it was from a laser treatment, right? So, but if you don't say something, that person goes on and looks at the next person in sort of, that same slightly, aggressive or negative way. And it's just helpful to have that information. It just puts it out there. And sometimes it opens a conversation, but it allows you to sort of diffuse what might be an awkward situation by sort of taking the upper hand and making it a positive interaction or an educational interaction, right? And choosing to set the tone for that instead of waiting for something that could potentially be negative or triggering or unfortunate, especially for your child, is just having that proactive approach to just informing people, teaching people things, right? I think that's one of the great gifts that we can give each other, is to share more about our experiences, to share more about the things we encounter, because it makes other people more compassionate, more aware, more understanding. So I tend to be someone who biases towards educating and sharing and just throwing it out there, because generally, the guess is, what's the worst that can happen? Okay, if I throw it out there, if I don't throw it out there, one, they continue in ignorance. Two, they might say something negative either to my child or to someone else, right? And you have the potential to also save other people from a negative encounter by proactively sharing. So.
And you're also helping yourself, because you are explaining it in a medical way, which is reinforcing to yourself. And along that line, on our website at birthmark.org, we have a great card. It's about this big, 5.5 by 8.5. It's called "It's a Vascular Birthmark." And on the front are pictures of kids having laser, kids with hemangiomas, port wines, venous, all of them. On the back are some facts that you can relate to the people in public. So I think maybe Emily or somebody can put a link on our page later that will direct you to where that document is. We do have some cards left. It's a glossy stock card. It can fit into your purse, backpack, car. We ask a lot of people to carry this because people have been stopped at the airport when their child had laser and accused of abusing the child because they've got the purple dots all over the face. And, we've actually had TSA people contact doctors' offices to say, is this legit? Is this really these marks all over this baby from a laser?
And it is a different experience, although, I always think if somebody really stopped and looked at it, it looks like a very, almost mechanical process, right? But it is interesting how people's response to it. So I always think that proactive approach is really helpful. And it just lets you have emotional control in the situation, which is sometimes one of the most critical things.
Yes, exactly. And you talked about, during my PhD program and in your field, we look at the Ericsson's model of development, and what that helps us with is expectations for different children at different ages. How would they respond? And so I wondered if even as little as 2 or 3 years old, people can be walking up to little kids and going, ooh, or, oh, what's on your face, or whatever. And be bullied, and actually be bullied or frightened. And, I know you like to focus on those levels because that's where the response comes from. So maybe starting at that 2-3-year-old awareness age, what are some of the ways that parents and the child can actually deal with being bullied, or somebody saying something to them bad, like yucky, or You know, I have one guy with a port wine on his neck and he was called a redneck. So he would wear a hoodie all the time and tighten it around his face so no one could see it. So if you have some suggestions, I know a lot of parents would like that.
Sure. I know that's always a difficult thing. And, you know, one of the things we know from bullying literature is one of the best things that people can do is tell other people to stop, right? So if you're around, then you clearly identify the behavior and you tell someone to stop, right? Like, this isn't helpful. Like, how would it feel if someone said that to you? Don't say that to someone, right? So when people say things, sometimes we have to be direct about calling out behavior that is bullying, that is negative. And I think it often depends on the culture that people come from. In some cultures, sort of shaming and bullying is actually kind of socially appropriate, even though we all know that that's not psychologically beneficial or helpful. And I think especially sometimes older generations, sometimes too, again, you'll hear these things and you think, who would ever think this is okay to say to someone? You know, this is terrible or cruel or mean. But I think it's trying to help people in those moments to have more empathy, to say, how would it feel if someone said that to you? How would you feel if someone looked at you and said that, right? This is a difference, this is a change, but this doesn't make someone feel good. And you have the ability to use your words in a way that helps people or that harms people. And, you know, make a choice to use them in ways that are positive, that build people up, that help people be seen for what they are and who they are. And I think it's a difficult space to always, I think children oftentimes the aggression or the bullying can take sometimes subtle forms. You know, it's a little bit of a teasing or a nickname or a something, and the child feels torn between sort of telling on them or getting them in trouble or disrupting, you know, the sort of social dynamic. I think especially as kids get into sort of preteen, tween kind of ages, they're less likely to always want to say something because it makes them become the victim and it, you know, kind of becomes an awkward space. But I think it's important to say, hey, if this happens, tell someone who can, you know, work with this situation and help people to understand that this is hurtful behavior, that this makes a difference in other people's lives. And sometimes it becomes, a lot of times that's been modeled in their family systems as appropriate ways of interaction or appropriate language. Whereas other people, you know, we might say that kind of language would never go down in my house, or we don't talk that way. But sometimes children are just mirroring the type of language they hear at home, which is unfortunate, but sometimes it takes some other role models to come in and help them understand that that's not positive or building language.
Thank you. We're getting in some good questions now, so this is really great. Mary said her daughter is 30 years old. She has an extended vascular malformation. My question always is, how do I obtain a way to help her? But now I feel like I need more emotional support than her, which again, I always say vascular birthmarks, anomalies, and related syndrome is a family disease. It's a family disease.
It affects the entire family system. And I think we need to be conscious that we are in these interrelated webs of relationships, right? As parents, as caregivers, we're deeply engaged in and invested in the well-being of our children, right? We feel their pains. When they're sad, we feel the sad. If they're in pain, we feel the suffering with them. If they're, you know, whatever the circumstance is. And I think it's important to address those. You know, one thing I encourage for everyone, whether you have a birthmark, whether you don't have a birthmark, whatever your situation is, I encourage journaling on a daily or regular basis. The literature is incredibly strong on the benefits of journaling, on the positive impacts of journaling, on the way that they help us to process emotions, to be able to label and understand the emotions we're feeling, to be able to see patterns, to be able to identify needs that we're having, ways that it's affecting us, whether that may be in the form of depression or anxiety or, you know, some different sort of directions. So I'm a big believer in journaling. And I think also reaching out, social support, people cope in different ways. One, we need sort of therapeutic releases. So that may be things like journaling or creative activities or whatever those are, gardening, running, whatever those are that help us release emotions. Other people cope with information. So information seeking, that's one place where VBF is excellent because it helps people access information and resources, and that gives us a greater sense of control. Another big portion is social support. So really looking to talk to other people. And that's one of the best things we can do as we're going through difficult experiences, is to talk to other people that are in those spaces too. Because one, it validates we're not crazy for feeling that way. Or it's like when you hear someone else's story, that helps you to sort of, I think, process your own story and your own griefs within those stories in different ways. And then you're also able to provide support and that same validation back to other people. So I think reaching out to others, being involved in the community, your story and experience can then go to support someone else's. It wasn't just like in vain or you just suffered for no reason, but you can use that challenge and difficulty to then be something that strengthens someone else and helps their experience to be less difficult. So I think really helping people see that they have a way to help from that experience, and that those difficult emotions and experiences that they went through help them to be more empathetic and helpful to others.
Thank you. And also as part of our More Than a Birthmark theme for 21, which we'll continue to carry on, our director of patient advocacy, Corinne Barnaga, who's also the chairman of the VBF board and a mother of a boy who had a hemangioma over 16, 17 years ago. And she is going to be doing more focus groups with our social media groups, with Leslie, with Chelsea Pentecost, with her network of parents and adults with birthmarks. So stay tuned, because we will probably be having mega Zoom sessions with just parents chatting with each other, and she'll be collecting data on what kind of things you need. She'll be working, like I said, directly with Leslie. So just stay tuned for that. She is posting in the string here. And as I said, her name is Corinne Barnaga. Many of you know her. She's been with VBF a long time. And I'm very excited that she will be actually dedicating quite a bit of her time to find out what do you all need to be able to cope better, because we experienced the same thing. And as a matter of fact, the next question completely relates to this, which is parents who are saying this: the most frustrating thing for me was I was a medical nomad, going from doctor to doctor to doctor before I even got an accurate diagnosis. So it's one thing you have a child with a birthmark. Then the next part is, okay, now you got to find out what kind it is. And you get like 6 different opinions. Then the third part is finding treatment, and that's extremely limited. Then finally, when you do find the treatment, insurance gets denied. So it's like a big storm. And we recognize this. We recognize this. And I spoke about this in Greece at the VBFI team. The average parent of a child with a vascular birthmark has 0 to 5% knowledge of a vascular birthmark. And if they do have any, it's because somebody else in the family had one. The average general care practitioner, pediatrician, whatever, has 5 to 10% knowledge. That leaves a gap of 90%. And that's what we focus on through educating you and educating physicians. And it's 27 years almost of doing this, but we recognize every year that we need to do more. And so I encourage you to visit our website, come back here on Facebook, and you'll start seeing many sessions, Zoom sessions that will be set up where you can just join and share your experience with other people live on Zoom. And we're very excited about that.
Well, and I think, Linda, just speaking to that, that is the story we hear over and over again of how many appointments it took to even, or this doctor says this, and this doctor says this, and this one says this, and I don't know who to believe. I don't know who to trust. and the parent is sort of left to their own devices to even know what direction to go. And that's an incredibly difficult position to be in as a parent who's again saying, I don't have the knowledge, and here are these professionals, and I don't even know who to trust when they're all giving me different information.
Yes, and wonderful question from Nicole Mellis. And she's saying, you know, what do you say to your kid when they say, I don't want treatment anymore? Like,
Yeah.
It's a medical condition. We constantly reinforce that it is about the skin. The skin can thicken, blebs. We talk about it being healthy, but in the end, in our opinion, somebody over 18 who doesn't want treatment, that's up to them. We have to respect that. But what do you say to a mom whose kid goes to her, whether they're a juvenile, a teenager, or an adult, and they say, I'm done. I don't want.
And I think that's something that we should be sensitive of, is even is allowing children to have some voice in treatment decisions, right? Because it ultimately, the child is the one who experiences it. So if they're really identifying that it's a difficult experience for them, we need to listen to them, to what they're saying. And we need to weigh out, if they choose not to keep pursuing treatment right now, what will that impact be for the future, right? Is it going to be a significant impact or a minor impact? And is it more important to respect their wishes? You know, maybe they're at a point in treatment when they're not getting a lot of clearance. You know, maybe they've gone through a large sequence of treatments and it's really not clearing a lot, then that would be a point when I would say, yeah, it's okay to take a break. Let's take a break for a while and then let's revisit this. You know, I know with my son who has a port wine stain, we did treatments when he was little. We achieved kind of a large degree of clearance. It's not totally gone. You can still see it. It hasn't really changed in quite a while. I revisited and asked him, would you like to pursue any treatment? And he'll tell me, I'm not interested in treatment right now. And I respect that. It's not changing. It's not, you know, and he knows what that experience would involve. And I think as a 15-year-old, I want to respect his decision about his body right now as to whether that's something he wants to pursue. I don't think pursuing treatment right now would have a significant impact on the future. So it's not really weighing out you know, if we start to see changes, yes, that would be a point to say, okay, we need to revisit this decision. But I think it's important to have that dialogue, because that can also be really damaging to relationships if a child feels it doesn't matter what I say, this is being done to me, no matter what I ask for, right? We also don't want to create that kind of dynamic in the relationship. And sometimes I think, especially with port wine stains, we can get so caught up in, this is the treatment schedule, this is the cycle, we have to keep doing it. But, you know, I know patients who after 40, 50, 60 treatments, you know, have been through a lot. And I think understanding and respecting the resources that go into that in terms of their time, their physical experience, their emotional, social experience need to be respected and dialogued about in a really honest way.
I really like that. And I love what Kristen Marie has to say. She said, I struggled with this. Sometimes I felt like explaining away my daughter's vascular birthmark before others said something was because I felt uncomfortable with it and needed to make excuses for her. I found the more acceptance I had, the less I cared about what others thought. And this attitude has trickled down to my daughter.
Yeah, I think it is interesting how our own sort of responses to it will be how our children then respond, right? We go back to the things we know, right? We respond in the ways that we saw other people respond to things. So I think as we think about how we approach them, we need to think about too, what are we modeling for our children? What is the dialogue that they're developing, or the way that they're going to approach situations as they go into the future, based on our modeling, based on our approach.
Well, we have 6 minutes left and 6 or 7, and I got a couple more that I really would like to share with you. And one's from Pamela Berry Reddy. She says, I'm blown away by this conversation. Thank you for validating so many of my feelings over the last 9 years. I look forward to more information. So like I said, I'm very excited that our chairman of the board and our director of patient advocacy will be doing this as an ongoing basis at least once a month. So stay tuned to hear more about it. And you'll also, her emails being posted in this stream. So if there's particular topics that you're interested in, maybe school, bullying, looking for a job, dating, negative comments, not wanting treatment, you know, make sure you just send that stuff to Corinne, and she will work with Leslie and work with her team to be able to hopefully get everyone everything that they need. So a couple quick questions. Abraham Zalalam says, my daughter is now 5. She has a port wine, but when she gets older, she is now starting to fear people to talk face to face. How can I improve her confidence to talk to people face to face?
Sometimes there's a little, I mean, understanding where children are developmentally too can sometimes play into this. One, we have temperament because different people are more introverted or extroverted. You know, like I was a very shy child. I didn't like to talk to people at all. In fact, if somebody came to the door and I had to open it, I would try to hide behind the door as I opened the door. You know, so those kinds of experiences aren't even abnormal for people without a birthmark, right? So some of that is temperament, you know, just kind of how we're wired. Another part of that can be developmental. You know, at times we're going through different social interactions, and we're kind of learning how to interact socially, especially with people of different ages at different points. So I think understanding that, but also helping them see that you provide value to the conversation when you engage with people. So, you know, when your child does, then you say, oh, thank you so much for sharing with this person or asking for this, but helping them see that that's just a part of daily interaction. You know, whether it's when we go to the store, I'm going to have you go and get this, or, you know, ask for this from the person or hand this to the person, right? That they kind of have a role or a task. So you can start to normalize and make those things more comfortable, but also trying to help them have positive experiences with people. Sometimes that even means setting up interactions with other people that are safe to them, that they know they can have more positive exchanges with, and then scaffolding that into more complex or different experiences from there. So helping them to have positive experiences with people they know or settings that are more controlled, and then developing more comfort, sort of staying with them and easing them into other situations that have those new variables of people they don't know, crowds of people, you know, people who haven't encountered them and may notice their visible difference.
That's excellent. Well, I'd like to wrap up with an amazing statement left by our chairman of the board and our director of patient advocacy, Corinne. She says, I once asked my son, Nicholas, if he wanted to have another treatment. He was about 6 years old. He said, wait a second, I'll go look in the mirror. He came back and said, nah, I look cool.
That's awesome.
And I think, like you said, Leslie, they're an important part of the engagement of the whole process. And you know, Dr. Nelson and Dr. Geronimus have said, yes, it's ideal to start laser treatment or the treatment of a hemangioma or whatever prior to age 1. That's ideal. The baby's face is this big, so it's quicker. You can get more clearance when they're young, but at any age, you can get laser and get significant improvement. It's not life or death to start before age 1. It's just that we're seeing it can be over with sooner, but still you need to be sensitive to what your child wants. And if they want to take a break, and even if it comes back darker, they can always resume treatment at their own pace And, you know, new things are coming down the road. New lasers are coming out with topical treatments. So just, you know, keep your eyes and ears posted on VBF on these monthly sessions that we have. And stay tuned for, if you have not, you should go to our website at birthmark.org and sign up for our email blasts. Obviously, you've liked our Facebook page, so you will see the announcements of all the sessions that will be coming up. Some will be geared towards adults, some for teens, some for parents. Some of them may be a mixed blend. We'll also be doing these sessions at our conference on October 16 in Irvine, California. You'll be seeing an announcement launching our conference very soon. So we will be in person. It will be slightly modified, but we will have the clinic, psychotherapy, the dental exams, and the only thing that'll be online will be the talk. So we are excited about it. We expect to have quite a few patients there. So Leslie, on behalf of all the families, I really want to thank you. I think it's been a wonderful and informative session. And all of you parents and adults that have called in or texted in, sent messages, we keep these all on our website. You can click on our YouTube channel icon at birthmark.org. They're also on our Facebook page, and we have them all the way back to 2017. There's quite a few with Leslie. You can go back and view them at any time with Dr. Nelson and Dr. Geronimus on new improvements in treatment, and Dr. Comey on Sturge Weber. So these are very valuable and informative sessions that we put together for you so that you can get an accurate diagnosis and an appropriate treatment plan, because that remains our top purpose. We want you to get an accurate diagnosis and an appropriate treatment. So thank you so much, Leslie, for being here today. Thank you for your valuable time. And I look forward to seeing you in California. It's been a tough time and we haven't seen each other in a while. So since 2019 because of COVID. So thank you.
I'm looking forward to it. It's always wonderful to be back together with the families and the community and just to make those important connections and provide that support. So thanks so much.
Thank you all, and stay tuned. Next month, you'll be seeing an announcement about who I will be featuring on our VBF Facebook Live in February. So stay tuned, stay safe, and stay well.